years has been reinforced by current debates over safety of genetically modified foods. The adoption pace is witnessed in the fields of biotechnology actually is consistent with previous trends in other generic technologies. The rate of diffusion will be fastest where biotechnology creates new products that do not compete with existing applications. Now, in the fields of healthcare, for example, the new diagnostic methods for a wide range of biological and non-biological expressions could involve such products. Now, the pace with the slow and possible, as you look at it, it will be punctuated by the controversy whereby technology seeks to displace existing processes and products or enhances the competitiveness of certain products. Now, in the face of the economy and development of Uganda, biotechnology can be an outstanding factor in fighting several daily challenges. And this too will facilitate fast adoption of the biotechnology applications, tools, and products. Once biotechnology is viewed with how it can assist a nation like Uganda in achieving its major sustainable development goals, we believe that biotechnology will not only be welcomed by government, but the public and the other various people as stakeholders. This application away from genetically modified crops will foster a clear image of biotechnology and other various applications of biotechnology. A case in point for this specific session we are having in herbal medicine. So specifically, this session and actually generally this season of biotechnology online series is concerned with the ability of Uganda to play a significant role in what is called as an emerging field involving a wide application of modern biotech in areas such as agriculture, medicine, and industry. So we are referring biotechnology as a confluence of modern biotechnologies and the market niches that they occupy. So today's session is specifically about herbal medicine, which is an important healthcare delivery system in Uganda, as in most African countries, especially given the extensive access to healthcare it guarantees to people. So the majority of people living in rural areas, where even with the national efforts to implement the healthcare program, including building healthcare facilities, access to healthcare is still a challenge in terms of distance and the cost. So in other words, how medicine has been used as a primary healthcare in Uganda by many rural communities for taking patients to hospitals. Now, in this discussion, we discuss how we could accelerate the herbal medicine to the higher quality production of medicines to improve healthcare in Uganda as a third sustainable development goal, and several other factors. Now, I would like to welcome our speaker, Dr. Godwin, who is actually a lecturer here, and I've been really able to actually glad to have been his student. And in this session, Dr. Anywar is going to take us through this session, and I would like to welcome you on the call. And I hope our people will be joining in later. So I take this pleasure to welcome you, Dr. Anywar, to take us through this session. Thank you.
Okay, thank you very much, Perez, for that introduction. And also thank you very much for according me this opportunity to talk to you about a topic I'm passionate about. So I will stop sharing my video in a bit and I share my screen as we delve straight into what I have prepared. Okay, so the topic I was given to present on is on advancing Uganda's bioeconomy through bioproduction, through biotechnology, with a focus on the opportunities and challenges in the herbal medicine sector, particularly on research and development. Now, by way of quick introduction, we'll glance at Uganda's economy. The GDP is around 32.5 billion US dollars, and the economy was projected to grow between 3 and 3.5% this financial year. That was, of course, after having taken a hit from the COVID-19 pandemic, where the projections were actually higher. They're in the range of 6%. Now, the gross domestic expenditure on research and development, which is referred to as GAD by economics, is a very important aspect I want us to begin by looking at, because it is widely accepted and used as an indicator for the research intensity, how much research is being produced in a particular territory. And it's an indicator. It points to the level of innovation in research and development in a particular country. So this gross domestic expenditure on research and development is usually expressed in terms of a percentage of the gross domestic product of any country. So Uganda, going by the last statistics I could get my hands on, was spending about 0.5% of its GDP on research and development. This is a very small proportion, as we are going to see when we compare to other countries, the world leaders. And it's no surprise that the countries listed here, the 10 countries, Israel, South Korea, Switzerland, are the biggest spenders on research and development in terms of the proportion of GDP. Of course, countries like the US and China spend much more. If you look at the actual figures, the actual amounts of money, but in terms of proportion to GDP, these countries are the leaders. So looking at this graphic illustration here, it drives the point further home. We see that South Korea is actually among the leaders in terms of research expenditure as a percentage of GDP. We can see where Japan lies. We see where countries like USA, Germany, France, UK lie. And there is a direct correlation, a direct link between the amount of money or the proportion of GDP a country spends on its research and development, and the level of development, the level of innovation, the level of output that country is producing. So you can't go wrong with investment on research and development. You'll always get value for money. There'll always be returns on your investment. And this is a point which African governments, African countries need to hammer and begin taking seriously. So the global spending on research and development keeps increasing with the competition between countries like the US and China. We are told a record of 1.7 trillion US dollars was reached. And surprisingly, only 10 countries contribute or account for 80% of this global spending. And it is little wonder that these countries are the richest in the world. So the more they spend, the more they are going to get. As part of the SDGs, several countries have pledged to sustainably increase public and private research and development spending. But this has to go hand in hand with increasing the number of researchers, because you cannot increase spending without capacity to absorb that money, locally built capacity. That's why it's also important to train researchers here in Africa to do that. The biggest spenders in Africa include our neighbor here, Kenya, and I don't know what Uganda is doing. So we are told that only 1% of the global investment in research and development goes to Africa, a paltry 1%. And it's also not surprising that the continent has or produces about 1% of the world's patents. So there is again a direct correlation. You spend less on research and development, you're going to have fewer patents being filed, and you're also going to have less money coming into your pockets, because you're going to depend on those people that are actually innovating. And this visualization from the world map actually shows the proportion of patents granted vis-a-vis the world map. If you look at Africa, for example, you can see these figures may be a little bit old. The more recent ones have a bulge towards Southern Africa. So most of the patents applied for in Africa are actually in Southern Africa here. And we can see how Africa and South America actually pale in comparison to the rest of the world, where patents are being applied for day in, day out. And the interesting thing is that many of the patents being applied for are things that are derived from Africa. From Uganda, for instance, if you did a quick Google search, you'll get to realize that there are over 12 patents on Wabugia ugandensis, the so-called, the wonder medicinal plant from which Covidex is being made. And none of these patents, by the way, are from African researchers. So there's a problem. And we are losing out. We are missing out on the benefits that we could derive from patents. The US, you can see Europe, China, and other parts of Asia are doing well. So the architecture of the Ugandan herbal medicine industry is such that most of the industries are SMEs, or small to medium-sized enterprises, and a great majority of them are cottage industries. They're operated from homes, people's backyards, people's kitchens. I remember when I started out as the CEO of Green Herbs about in 2007, I was making my first products from my mother's kitchen. So many people actually start from homes and they operate from homes. So the Ministry of Finance, Planning and Economic Development has actually categorized the micro and small to medium-sized enterprises. The small ones employ 5 to 50 people with an annual sales turnover of up to 100 million. The micro enterprises employ up to 4 people with an annual turnover of up to 12 million shillings. Now, according to the Uganda Investment Authority, there were an estimated 800,000 small to medium-sized enterprises located in urban and rural areas of Uganda. And these were actually contributing a whopping 90% of the private sector foundation, meaning that these industries are a force to reckon with. They are a huge economic driver. But the unfortunate thing, in my opinion, is that they are not being given the attention they deserve. They are not receiving the recognition, the funding, the financing they need. The COVID-19 pandemic has brought to fore or has actually helped in the emergence or the growing of some of these industries. One of them is Jenner industry, which is responsible for making COVID. Then we have Kazire Industries, who also put out a product, a herbal product called Vidicin for managing COVID-19. And there are many other homegrown or indigenous industries which are doing well. I think the government has a role to play. Of course, we commend them for coming out to support industries like Jenna, but I think this approach is very selective, and we need a better all-round approach to support the herbal medicine industry generally in Uganda. So the herbal medicine industry in Uganda has a number of characteristics. One of them is that they are largely informal or non-formal, like I've already mentioned. Many of them have actually been doing things the traditional way. They are not registered, for example. They do not follow certain standard operating procedures. The herbal medicine industry also heavily relies on Western medicine and Western tools for diagnosis. Then there is no single body governing them. They are in separate small groups or associations with different interests, and this makes them very difficult to regulate. Some of the associations include Uganda Nedagala Yayo. There's a Uganda Herbalists Association, which tries to assume a national form, but still many herbalists do not subscribe or conform. There is no structured or formal curriculum for training herbalists in Uganda. And I want to draw attention to a case that we were introduced to in Mali, where in the medical school, for example, I mean, it's very interesting. More than 80% of the population rely on herbal medicine. Then the medical schools are training doctors. These doctors are going to interact with patients who are already using herbal medicine or who have used herbal medicine before going to hospital, but they don't know anything about herbal medicine. So in Mali, they incorporated a section, formal training on herbal medicine in the medical school. So you go to medical school, there are a certain number of courses you'll have to attend on herbal medicine.
Are you coming to campus or are you working?
And you'll have to pass those course units for you to be passed out as a medical doctor. And that actually helps. There's a lot of hostility in countries like Uganda, where the herbalists are pitted against the doctors. The doctors look at the herbalists with suspicion, and this is largely partly due to the fact that the Western trained doctors do not understand what the herbalists are doing. They don't think there's any value in what they are doing. And this training is actually very helpful, can be very helpful in integrating the two. In countries like China, where you move to, even in Mali, there are some health facilities you move to, and the herbalists are operating side by side the Western doctors. You'll get a proper diagnosis, then you get a prescription depending on what you want. If you want herbal medicine, you get a proper prescription from a herbalist, a well-trained herbalist, and you can pick the drugs from the pharmacy in that very health facility. If you prefer Western medicine, you will still get the conventional drugs there. Then another characteristic is that they are poorly regulated because of the challenges I have mentioned, but also due to the fact that the regulating authorities in Uganda, it's the National Drug Authority, they do not have the capacity to monitor and to police the herbalists, so they end up doing whatever they want. Then they are poorly researched. Most preparations rely on indigenous knowledge that are not scientifically verified. Then many of them are poorly developed. We still have challenges with hygiene, poor packaging. There's also a poor referral system. The herbalist, for example, may not know when to refer a patient that needs critical care. And this is very, very important, and only exists in countries or in systems where they have a well-developed collaborative system between the herbalists, and there's an exchange of knowledge, because knowledge is not a monopoly of one system. So what are the opportunities in the herbal medicine industry for research and development? The biggest opportunity is the growing demand for natural products. And this growing demand for natural products should be matched by people that have the skills to produce, to process, and to package quality herbal products that are going to meet the requirements of the populace at large. And this is compounded by the fact that the ratio of traditional medicine practitioners to the population is between 1 to 200 and 1 to 400. In other words, for every one traditional healer, there are between 200 and 400 patients. Whereas that of the conventional or Western trained doctors is 1 to 20,000 patients or less. Meaning, for every one doctor, they are up to or even more than 20,000 people. So the doctors are not going to have time, adequate time, to spend with the patients. And given our culture and the way systems work here, sometimes patients need that holistic approach. They just need someone to listen to them. And that is part of the healing process, which they are denied by the fact that there are very few Western trained doctors. Another great opportunity is the young herbal medicine industry, which requires a lot of technical expertise. I'll give an example of one that I'm familiar with in Western Uganda, the Wells of Hope. It's a shea butter factory that has been set up by a German national who married a Ugandan, and it is a very big industry that is situated right in the shea belt in northern Uganda, and it is contributing to the conservation of this tree, which is endangered. The media has been rife with people cutting down shea butter trees for making charcoal. But because people can see an industry in their vicinity that is actually paying them for the shea nuts, they are protecting these trees, they are guarding them, and they are able to earn a living from the shea butter trees, which they themselves didn't even plant. So they are conserving the environment. But another thing this industry needs to be commended for but they add value to it, and they have tried to make products which you can find on the market. They are also targeting the export market, especially the European Union. Unfortunately, the global shea butter industry has been dominated by the shea butter from West Africa because the governments there took time to research and market their shea butter, whereas we are sleeping. And the Germans here are telling us that our shea butter is actually superior to that one in Western Africa. So there is a niche for our shea butter, and such industries need to be commended. There are many other plants I could talk on and on about, but in the interest of time, I will perhaps talk about, there is also this plant from Karamoja, the Acacia here, which is very good in the food and beverage industry. This industry has been neglected, and yet there's a lot of demand for it. There are companies that are exploiting this gap and are moving to the Sudan, to Ethiopia, to try and get acacia cereal, which fetches, this is gamma arabic, which fetches a premium on the market, and it is in high demand in the food industry. So the demand for many raw materials is high. I'll give another example I had from personal experience. When Covidex was just being produced, my friend, Professor Guan, called me and he wanted what is it called? Lemongrass oil. And he wanted large quantities of lemongrass oil. One of the challenges we had, or we're having, is that people were adulterating this lemongrass oil. They get the genuine lemongrass oil, and because they want to get a lot of money from it, they mix it with other things, so the quality is not good. And it is one of the ingredients he was using in Covidex. So we had to move around looking for this oil, and it's not easy to get. Apparently, it was not easy to get, and the demand is quite high. Currently, a liter of this oil goes for about 200,000 on the Ugandan market. If you are well organized, there are people I know of who are actually producing it for export to the European Union. Then there is the opportunities for funding. There's a private-public partnerships, government programs, crowdfunding. One of the government funding programs that I know of was that one by the Private Sector Foundation. Of course, you had to write a proposal, meet their requirements, and they would avail funding. They would avail funding for you if your venture was viable. And I know of one local industry, herbal medicine industry, that benefited from this. You could also use crowdfunding. These are local funding opportunities, but they are international funding opportunities. I don't know how many of us have heard of crowdfunding, but crowdfunding is a big thing in the US and in Europe. If you have a viable idea and you can be trusted, people can contribute very small proportions of money globally, and you can end up raising money you need for doing research. I know of someone who benefited from this, Professor Quav in the US. They wanted to investigate some medicinal plants, especially from Africa, as potential COVID-19 candidates. And because COVID was hitting hard in the US at that time and people were looking for options, by then the vaccine had not yet been developed. People are contributing money, you know, very small amounts of money, but if you have 1 million people each contributing $1, you end up raising the money you need, and they were able to raise a lot of money, which they are currently using to fund their research. So there are opportunities for funding. Then even there's direct funding from the president. If you have access, you can benefit from that. The Uganda Exports Promotion Board has a list of products that are on high demand. So if you got in touch with them, for example, they could tell you that easier now to import certain pieces of equipment, especially if you are doing it online. There are companies which can help you with. Then there are new and emerging markets. So the online marketing can actually open you up to markets beyond your current location. So you can get exposed to people beyond your boundaries, and you can actually earn much more from this industry. And I saw it happen to us before the lockdown. Actually, COVID opened opportunities that were previously unavailable for green hubs, because when the lockdown came and certain things were not able to continue business as usual, we intensified our online presence, and because of that, we are able to tap into certain markets that we didn't have before. Another opportunity is the technologies. There are newer emerging technologies, better research facilities. So you could, for example, use tissue culture techniques. I'm just using this as an example. So instead of growing, let's say, wabugia on acres and acres of land, you could be able to produce some of those important alkaloids using culture methods in the lab. So you culture and you produce maybe colors in perpetuity, and you're able to harvest and purify certain alkaloids of interest, and that opens up great opportunities. So we have numerous research facilities now and potential for collaboration. For example, you can partner with the Uganda Industrial Research Institute. They have funds and they have programs dedicated for helping people in certain fields. Then even Makerere has very good laboratory facilities and other government agencies. So the opportunities for research and development are expanding. They are increasing. There is an opportunity for conservation of threatened plant species through novel technologies. I've already talked about some of these, the micropropagation techniques, which can also be used for mass production. And this is where you can come in with your expertise as a biotechnologist. How do you leverage the knowledge you have, the skills you have? People are producing bananas or coffee on a large scale. What medicinal plant species can be subjected to these technologies? There are some plant species that are in very high demand, and we know are on the brink of extinction. So some of these can actually be subjected to some of these technologies. Someone from India was contacting me. They wanted Mulondo, Mondia White in bulk. You could also, and there's a high demand for Mondia White in this country, and I'm worried it's being depleted because these days you get them selling very, very tiny roots, meaning they are not allowing the plant to regenerate. Because of demand, they are harvesting it and they are selling the young ones. So that is something you could venture into, and you can produce for export because there are large international markets that want these products. So you can produce and supply. There are also companies in Europe and America that outsource the production of some of these things. For example, the African Viagra, Cytopsis articulata, is extremely difficult to get. So because of the demand created internationally, and because some of these plants cannot be grown in foreign environments, there are companies which look out for reputable organizations or farmer groups, and Uganda is well known for its organic farming. So they look out for this, and you do a contract farming. They say, can you produce for us a ton of Mondia White? Of course, they give you technical know-how, technical help. They send their experts. You produce and you get your clean money. And this contract farming is happening a lot in South Africa. We have not embraced much of it here. South Africa and Egypt are doing well. They are producing many of these plants for export for companies in Europe, and I know quite a number of them in Germany. So we also need to take advantage of the technologies and merge them with biotechnology to produce innovative products, innovative packaging and delivery mechanisms. The nanotechnologies and the like, having soft gel capsules, having instant teas, instant herbal products. One of the things we have with herbal medicines is if you put it in, if you put a powder in a cup of hot water or tea, for example, you get a lot of residue. You're not able to dissolve everything. But just imagine you had an instant tea of a certain herb. You put it in water and everything dissolves, and you're able to take it without the hassle of filtering or having to worry about taking residues. So another opportunity, well, let me see. Yeah, maybe before I talk about challenges, another opportunity, perhaps this will come in the remedies. I'll talk about it when we're talking about remedies. But there's a huge opportunity with cannabis in this country. So one of the challenges is a limited technical know-how on some aspects. A common request I get from people is how to use preservatives and which preservatives to use. Many people, unfortunately, don't do this. They just go and get whatever preservative is on the market. They don't know what quantities to use, and they end up poisoning people. They end up causing more harm than good. Some people do not have market access. There is resistance from the Western establishment. I take you back to the COVID story. Remember how there was a lot of opposition from the National Drug Authority? And some of the reasons they were giving, in my opinion, were flimsy. For example, they didn't want the name COVID to appear in the drug. They didn't want it to have COVIDX. They were claiming that it was misleading, and yet Western drugs have the name of the disease in the drug. For example, Malarex, headaches, and the like. They put up a number of barriers, but fortunately, the president has a soft spot for herbal medicine. He knows what herbal medicine can do, and the owners, the proprietors of this brand were able to overcome that challenge. We have a problem with quacks, of stigma. There is mixing of witchcraft and herbal medicine. So this reduces the credibility of herbal medicine. The other day, I was invited to Bukede TV to talk about some herbal products. And the producers were thanking me for coming because they were saying the people who go out on media, the people who are advertising, are actually not the genuine people. And those are the people occupying the spaces where people can listen to them. So they end up getting, the wrong information, wrong products, and they themselves have no control over it because they want money, and these are the people coming to them. So they end up working with them. So that is a big challenge. The free market economy, which does not allow interference from government, is also a hurdle. A big hurdle, if you ask me. I think government should own a certain percentage of shares in all foreign-owned companies, because this will help in the transmission of technical know-how. And I want to give examples of the cannabis industry. Our recent research has shown that there are over 12 licensed companies to grow cannabis in Uganda. And they are growing it for export for the European market and the American market. Now, these are foreign-owned companies. They come with their own seed. They come with their everything, their own technical people. They grow the cannabis. They pay government a tax. That money hardly trickles down to the local person. and the cannabis goes to benefit people in other countries. And yet, many people are using cannabis locally here, but because it's illegal, they hide. And there are ways of going around this. Many of these companies, for example, are producing cannabis from which the addictive component, the tetrahydrocannabinol, has been removed. Hence, it retains the medicinal properties and is non-addictive. And that is what is trending globally. People are asking us about cannabis, but because of the legal challenges, we do not delve much into it. And that is something very easy to handle. So if government can introduce a policy and say that for all these cannabis industries, we have to have our local scientists, graduates, biotechnology, name it, should be employed, a certain proportion should be employed in the industries, then value should be added on those products here before they're exported. Because when you add value, you fetch a premium, you get much more money by adding value. And the space should be opened up because there's overwhelming scientific evidence to show that medical cannabis actually works. It is good. And it can be used within the confines of the medical establishment. Then the issue of specialized bioincubation centers. I saw this while I was studying in Germany. They have, for example, for the biotechnology sector, you can have a hub, a biotechnology hub located in a particular area. Now, this hub will usually issue out invitations. People apply. If you have what you think is an innovative biotechnology idea, you apply, the idea is vetted, and then you're taken on, you're given space, you're given reagents, you're given resources, you're given a mentor. So if you want to develop, for example, a bio yogurt or a medicinal yogurt, you're taken on, you are given office space, you're given reagents, you're given maybe up to a year. You begin working with these people to help you develop the idea. Then once it is ready for market, they actually help link you with industry. They link you with people in industry that may be interested in buying this idea. They help you in sourcing for funding, maybe from government funding bodies. And you learn other skills along the way. For instance, before you are admitted, you should learn how to write a business proposal, a business plan. And this business plan is looked at critically, and it helps in guiding you and informing you along the training process. So that even when you come out properly trained with your idea ready to be put on a large scale, you have the requisite knowledge and skills to move forward. So this is something that is still lacking in our country. The Uganda Industrial Research Institute is trying something a bit like this, but it is still on a very small scale and it is limited. So this, I believe, can go a long way in expanding and improving the herbal medicine industry, which has a lot of potential. So in conclusion, I think the government needs to invest more in research and development. And I would also recommend setting up of an independent medicinal and aromatic plants research center, something maybe the equivalent of NARO, which is looking at crops. We have something looking at medicinal plants, where we do extensive research on our indigenous medicinal plants, document them, and have products developed. And this can go a long way in improving our economy. So there's a lot of potential for biotechnologists and other plant scientists, and the herbal medicine industry is growing and needs people to fill in the vacuum. So I want to thank you very much for listening, and I want to invite maybe questions or comments at this juncture. Thank you.
Thank you so much, Doctor. That was a very insightful discussion and presentation. We are really glad to know some of those concepts. Yeah, it is a field of medicine that really doesn't have a lot of, information about it into the media or even other regulatory bodies or even the government. So we are really glad. Now, at this moment, I want to welcome questions. I had posted in the chat space that you could keep the questions coming as direct messages. Of course, I'm going to give a chance to those who may want to voice out their questions. You can raise your hand and then we unmute and then you're able to submit your question. But Doctor, you mentioned
Yes.
that the sector is not regulated. Really, is it possible to regulate this kind of medicine, herbal medicine, looking at how it is being practiced? For someone who is practicing it in there, like where you began from, and for which several others are using it and commingling with this witchcraft. How best do you think this can be regulated, in your opinion? Thank you.
Thank you very much for the question, Perez. I actually said it is, I didn't say it is not regulated, I said it is poorly regulated. And it is only recently that traditional and complementary medicine bill was passed by Parliament and assented to by the President about a year ago. It is very recent. And we had been in that state for a very long time after a lot of lobbying. So it is now operational. But responsible for that, for example, does not have the capacity. They are thin on ground. And one of the best ways of doing this, what the bill has done is that it has separated the spiritual aspects. The people tend and be verified by science. So that is one way of doing it. But I think there needs to be a lot of awareness, a lot of training, a lot of education on the part of the herbalists and the population, but even the doctors, so that because there is a misunderstanding, we do not clearly understand what herbal medicine is and how it operates. So we need a lot of, I think the approach similar to what was used by the Uganda Revenue Authority can help. You need to reach out to the people, the stakeholders, train, educate. It's a continuous engagement before you come to start clamping down and arresting, and that can go a long way in improving the industry. Thank you. I hope
Thank you,
I've answered
Doctor.
the question.
Yes, indeed. Now, in your opinion, is the IP system in Uganda facilitating innovations in this sector? And how may the facilitation be enhanced or stimulated, in your opinion? That is in the case that the IP system in Uganda is maybe in place. So you can go to where, is it there or something?
Sorry, I didn't get the question. I missed part of it.
Yes, Doctor, I'm saying, is the IP system in Uganda facilitating innovations? And how may this facilitation be enhanced or stimulated? That is, of course, also a question if there is an IP system in place in Uganda.
To the best of my knowledge, Makerere has Makerere University has an intellectual property rights policy, and I think it's the last time I checked, it was the only institution of higher learning that had this policy. which I think perhaps other people didn't, other institutions didn't have, like Gulu University. That's why they had challenges with Professor Guan. But of the intellectual property rights issues, so for science and technology, there was a time NEMA was involved. So it is also not very strong. NEMA was the CBD convention for the Convention on Biological Diversity. So in my opinion, it is still not very strong, and we still need a lot of engagement, public engagement, and dialogue, and to discuss ways of strengthening this IPR issue. Yes, thank you.
Okay, thank you. Now, in your discussion, you mentioned a few of the challenges that we have, like the technical know-how that is not in this sector of medicine. Now, I would want to ask, in your opinion, how can we generate human resource and how can we put these strategies in place to make sure that people partake in this sector? And of course, I'm going to link it with this next question. What are the connections with the indigenous knowledge base or traditional knowledge? And how are these sustained in the modernizing practice of this sector? Yes, Doctor.
So if I got your question correctly, how to link traditional medicine with sorry, could you repeat it? I think I mixed up. I was reading something on the chat.
Oh, so I'm trying to ask human resource development strategies that can be put in place to facilitate human resource into this sector.
Yes,
and I linked it in with a question that is, what are the connections with the indigenous knowledge base or traditional knowledge, and how are these used in the modernizing practice? Yes.
Okay, yeah, training, we definitely need training. There are some organizations, it is being done, but it's not well coordinated. I'll give some examples. In PG district, we have an NGO called Prometra. Prometra has a forest school of traditional medicine. They deal with herbalists, and they have been offering training, 3-year training programs to herbalists, but they are done, it is not an accredited program or a certified program. So the training is done in the local language in Uganda for the herbalists. And they train them on different aspects of herbal medicine. And when they finish, after the 3 years, they are passed out, they are given some certificates. So I think the ministries, the bodies responsible need to come out and see how to streamline this program so that the training is standardized and we have, products that are good. Mbarara University also had some short certificate courses for people, for herbalists, but still this is not enough. The efforts are scattered. There are some individuals involved here and there. Then certain companies contact or consult some of us as experts to go and meet with their staff and train them on different aspects of how to improve the practice in their sector. So there are scattered efforts here and there, which are not well coordinated. And that is a gap. There is a gap which needs to be addressed by the relevant authorities.
All right, thank you, Doctor. I think that is really a good insight because honestly, there is a lot of potential according to presentation in this sector. And because we've been arrested into calling it so much informal, such discussions are tailored to make sure we see how to modernize it and merge it with the formal sector so that we are able to advance the bioeconomy of Uganda. Now we have some questions in the chat space. There's a Jamil Serwanja. He's asking, he's actually in Austria, sorry. So he says, you talked of resistance of the West to African medicine. He brackets with herbal medicine, an example of Covidex. However, in the West, for something scientific based to be accepted, there must be a process of publication and peer review of said products. With Covidex and most herbals, to the best of my knowledge, there exists no published reports to support the overwhelming claims. How can Ugandans and African herbal medicine be taken serious if the scientists are not taking it seriously?
Okay, thank you very much for that question. The dilemma or an emergency with the emergence of COVID. And number two, many of the plant species used in scientifically, they have been scientifically proven to be efficacious in treating various ailments, both using cell lines, but also in animal models. So there was or there is scientific evidence to support the use of these medicinal plants, although clinical trials may not be available, but at least there's a starting point. And then the World Health Organization actually recommends that if herbal medicines or if a medicinal plant has been in use over a certain period of time, I think it's 20 years, at least 20 years, by the community. It is well known. It has been used for treating a particular ailment. With a certain level of reasonableness, you can assume safety. And there are certain basics you can really do. So because of the COVID situation, the fact that it was an emergency, I think they overlooked some of those things, especially the clinical trials. And you'll agree with me that the same standards were also applied for the vaccines. For example, the vaccines that were produced by the West did not go through the full regulatory regime. So the long and short of it is that there is evidence that there is some level of evidence. We only need to build on it to gain approval from the scientific community that these plants work. So it's not that there is nothing at all. There are publications, there is scientific evidence. We just need to generate more evidence.
Yes, thank you, Doctor. A question from Shira Namirem. She asks that you mentioned the cannabis industry, which is booming in the Western world in the practice of medicine. She says that she's aware of production going on in Uganda, but highly foreign dominated. So she's asking, is there a way for Ugandan scientists to tap into this that you may deem viable?
Hello?
Yes, Doctor.
Sorry, I lost you. I lost the last part about awareness of cannabis production in Uganda.
Yeah, that she's aware of a production going on in Uganda, but she states that it is high foreign dominated. Now, she's asking how Ugandan scientists can tap into this and which ways you may deem viable. Doctor, are you there?
It is the government which granted these foreign farms licenses to come and operate. And we are crying foul. We are saying that we have local experts here. We have local varieties of cannabis. But because the system is closed, it's opaque, you cannot see what is going on. You don't know who is involved. You don't know how much taxes are being paid. So there are people producing this cannabis using, they call them standardized varieties from wherever, and they're exporting this thing without us benefiting. So government needs to come in and say, look here, for you to operate in this industry, we have to employ maybe 40% or 50% or 80% of the workers should be Ugandan, and they should be at all levels. And then the government also needs to come in and own a certain portion or proportion of these shares of these companies to arrest capital flight, so that if these companies are falling, for example, we will have gained a certain level of technical expertise, and some of these companies should be able to continue. And that is how China got an upper hand. You know, that is how they are able to produce many of these things. They didn't start from scratch. They didn't reinvent the wheel. So we are simply saying that government needs to take this issue seriously and have a say. We know it is a free market economy, but some of these need to be introduced so that we can help our own, because on our own we can't do it, but we can also, through advocacy, through different associations, organizations. For example, the biotechnology students can petition the powers that be, and we can move through, you know, different umbrella organizations so that we get government to hear our voice. Otherwise, if we just sit back and fold our arms, the local people are not benefiting. Our graduates are not benefiting from this. Thank you.
Yes, thank you so much. There is a question from one of us. Joanne, you may unmute and forward the question right now, and then we'll proceed. Thank you.
Okay.
Yes, thank you so much, Grace, for the opportunity. Thank you, Doctor, for the wonderful presentation. My question is, okay, for the starters the students who may be interested in herbal medicine research, how best can we start? Is there some technology that we can use to maybe identify these medicinal plants? For example, we're in our villages. Is there some kind of information of the place in different languages? Yes, that's the first one. Then if I take a COVID-19, am I also supposed to take the vaccine? Yeah, thank you.
Okay, thank you very much for the questions, Joanne. Yes, there's a lot of literature on the different Ugandan medicinal plants and their local names, their vernacular names. Only that you will not find all this information in one place, but you could look up, for instance, Trees and Shrubs of Uganda by Katende and others. Then your lecturers in the department, most of them have published a lot of work on medicinal plants. So you'll find a lot of work on these medicinal plant species, their local names and what they do and how they work. Then if you want to start, a good starting point is the Uganda Exports Promotion Board, because some people have approached me and they say they have land, they are looking at what they can grow, what they can export. Uganda Export Promotions Board can advise you on some of the plants that are on high demand, where the potential markets are. Even the ministry, actually the Uganda Exports Promotion Board is under the Ministry of Trade, Industry, and I forget the other one. So there is information available. There are different bodies. There is NOGAMU, the Natural Organic Movement of Uganda. They have certification processes and lists of some of the organic products that are demanded in different parts of the country. So you can also, there is a lot, there are NGOs that are involved in this. So you just need to keep probing and asking and talking to people. There is a lot of information you can get. Before COVID, there used to be exhibitions, different exhibitions organized by different bodies. So those would be nice starting points. The Uganda Investment Authority, for example, would tell you which are the investors and what are they doing. So there's a lot. There's so much you can do. Yes, over to you, Perez.
Yes, she also asked another question. If she takes Covidex, can she go ahead with?
Yes.
Yes.
I think the best person to answer that question would be the maker of Covidex, but I know the vaccine is for preventing or reducing the chances of you getting a severe infection if you caught COVID. So getting the vaccine is not a guarantee that you'll get COVID. For Covidex, of course, Professor Guang was telling us they are going to begin clinical trials. So there's a lot of information that we don't have. I cannot speak authoritatively on Covidex, but I know Covidex is for the management of symptoms of COVID. Thank you.
Yes, thank you so much. There's a question again from Shira Namirembe. I think you maybe responded to part of it, but I'm going to read it regardless. So
Yes.
she says, in regard to the Western versus herbal medicine, she asks if the mistrust in herbal medicine is as a result of insufficient data. And she's also asking how to commercialize herbal products. Maybe also she was asking about phases, if you people conduct those clinical trials.
Maybe I'll start with the last question on clinical trials. Clinical trials are very, very, very expensive. They take years to be conducted. They take large sums of money. So it is nearly impossible for someone to conduct a large clinical trial on a herbal product unless they have funding from government or industry. Now, it is very unlikely that you'll get funding from industry because these are going to be your competitors. The people making the vaccines, the people making these other Western drugs are the ones that have that kind of money. Companies whose GDP is bigger than the GDP of, companies whose annual budgets are bigger than the GDP of Uganda. So they wield a lot of financial clout and they control many things. So conducting a clinical trial is not an easy thing. With Covidex, we are told, of course, with funding from government, the government is going to support conducting of clinical trials. Yes, there is a part of the mistrust is due to the insufficiency of data, scientific data to back these claims. For you to get the scientific data, you need to do research. For you to do research, you need money, and we have already been seeing how much money is being spent on research by Uganda, by the government of Uganda. So it becomes difficult. We are going to, the gap is going to widen, and the process is cyclical. We are going to remain in that cycle. It is difficult for you to keep, to generate sufficient scientific evidence. So some of the evidence we generate as researchers here may not be clinical, but we basically do studies, for example, to prove if plant X has antibacterial properties, antiviral properties, if it can help in lowering blood glucose levels and the like. But we seldom escalate those studies into the clinical setting to humans, because that is very expensive. But slowly by slowly, we are getting there. And I think there's growing evidence, there's a growing appreciation of the fact that herbal medicines have a very important role to play, even without that clinical scientific evidence to compare it with the Western drugs.
Yes, thank you so much. Now, my last question to you would be, how can we construct an institutional framework for traditional medicine practice with the view to identify and also fill these gaps and constraints that you named in this presentation, Doctor?
Yes, such a framework should be a multi-sectoral, multi-stakeholder approach, where you have the different stakeholders coming on board. There should be a will, and of course the process involves money. The Ministry of Health should set aside a budget line to cover this, and it is a process that, in my opinion, will take a bit of time. It is not going to happen instantly, but it can happen if the will is there. And there are a number of things, some of them have been suggesting, that can be done to help in the integration and ensuring that there is a framework which accommodates all stakeholders involved.
Yes.
Thank you.
Thank you so much, Doctor. I want to take this opportunity to thank you so much for according us time and coming to speak to us on the Biotech series. I'm really grateful to you. At least when I reached to you, we were able to harmonize and come up with this kind of, a topic and able to share it today. Now, I want to thank the members also who made it on the call, Professor Arthur, who stayed with us. We also had Professor Kakudidi on the call, but I think she just left. We had our patron of the society here at Makerere University, Dr. Mustafa Sadiq, who was also with us. We had colleagues from the alumni fraternity. I saw one of our colleagues, Becky Angom, who gave us a session the other day about the opportunities and the industries that we can tap into as young biotechnologists. Today, I also want to mention that one of our presenters, actually Dr. Musime Titus Moses, is having a presentation, actually a defense for his doctorate. And it's going on, I think, right now. I probably hope we either wish him all the best, but I know he's going to deliver. I was going to say we actually pray for him. But we are really glad that most of these people are making it out there. And this is part of, generating the human resource. Musime is working with the Cancer Research Institute in Bergen, University of Bergen. So we want to thank you, Doctor, for sparing time. I thank the colleagues who are in examinations. Actually, that's why we are not able to raise a very good, impressive number on the call, because most of our colleagues are doing exams. But we had this session recorded, and I promise you we shall upload it on our platforms. They will be able to follow. I'm proud to also note that in this session, we had several sponsors. We had UBBC and PBS. BBC is Uganda Biotechnology Biosafety Consortium, and PBS is Programs for Biosafety Systems. They supported us to make sure we organize this session. We are really thankful to them. And as of course, a matter of fact, we shall generate a report with them that we shall submit to the relevant people and authorities. And I'm really glad that the initiative is growing. Today we launched the second season of the Biotech series. And this is something we had dreamed to, achieve when we began. We are glad to see that the initiative goes on to grow. And as we go on to conduct such sessions, we are really hopeful that there is something that can be done in this sector. Another thing I would love to mention is that with the new concept of bioeconomy, I want to thank you, Doctor, that you actually explained and actually your presentation was tailored along that we need to know how best this herbal medicine research, the industry of herbal medicine, I want to call it an industry because it has that potential, how it can assist the country reach some of these like the SDGs, the third goal, the health facilitated, actually successful health system, those sustainable development goals, whose deadline is in 2030, but I wonder how we approach to that when we are not developing some of these sectors. So this is part of the discussion that we've had on that bioeconomy. It is a new concept. We are trying to look at several other sectors. How can we do biofarming? How do we contribute and tap into this bioeconomy? But particularly in these sessions, we shall always look at how biotechnology can be a boost to all this. I want to encourage us to be here, I think, next week. I haven't yet confirmed the date, but I shall be communicating to you. I want to thank you for making it today. Several colleagues that have been with us, the president of the Biomedical Society in CHS is always here with us. We are thankful to you, Mr. Jason. And I'm seeing one of the speakers of the MOOC Society, Prudence. Thank you for being on the call. We are really grateful to you. I'm seeing, yes, one of our sponsors is here. This is Mr. Eric Kagezi. I'm really grateful that you made it on the call. I think you found us concluding. I hadn't noticed that you're on the call. And we are really grateful. So for those who are doing exams, you shall be able to see this call recorded somewhere. We shall post it on our media platforms. We are thankful to you. And I want to take this opportunity to again, thank you indebtedly that this was really great. And I hope to see you in the next session. Thank you so much and have a good day.
Thank you. Bye-bye.
Bye.
Thank you so much. Anywar.